In a bold step towards transforming healthcare in Saint Lucia, Minister for Health, Wellness and Elderly Affairs, Honorable Moses Baptiste, unveiled plans for a sustainable health financing model. During a recent press briefing, the minister confirmed that this new approach will address the long-term funding needs of the nation's healthcare system while ensuring better access, quality care, and sustainable funding, ultimately improving the overall health and well-being of Saint Lucians.
This government continues to work on what we call a sustainable health financing model. We are working with the World Bank, and we are also working with a consulting group called JIPA. We have said so before in the public, and we are going to come up with a health financing model which brings together both the public sector and the private sector. We have been in consultation with the Tapion Hospital, we've been in consultation with the St. Jude Hospital, the Millennium Heights Medical Complex, insurance companies in St. Lucia, the National Insurance Scheme, to come up with a model which is sustainable, which we will be able to finance, which we will be able to fund, and which will be to the benefit of the people of St. Lucia.
Baptiste further emphasized the distinction between his government's approach and that of the previous administration, noting that specific healthcare services were identified and gradually introduced as part of the effort to achieve universal health coverage.
We came into government and we decided that we were not going to wait for the complete financing model or for the complete financing policy before we provide services to the people of St. Lucia under universal health coverage. So we selected those aspects of universal health coverage or the services that were manageable for the time. So we selected maternal and childcare services. And so far, thousands of St. Lucians have received services at no cost to them. Then we selected cervical cancer services. And so far, hundreds of ladies in St. Lucia are accessing services at no cost to them. Then we went into the prostate cancer diagnosis. And so far, a number of men have accessed the services and more are accessing the services as we go along. So while we are working on the financing model, which is a very challenging proposition, not only for St. Lucia, but for all countries that have gone into universal health coverage or health insurance, and we have looked at all of the evidence from the other islands, the other countries, where some of them started, and the pitfalls and the challenges that some of them are having, and we wanted to ensure that St. Lucia has a sustainable financing model. But meanwhile, we are adding services, the basket of essential services, we are adding services so that the people of St. Lucia are getting services under universal health coverage while we finalize the financing model.
Referring to the phased approach of the healthcare financing model, the health minister confirmed that the goal is to progressively add more services as the government strives to achieve universal health coverage for St. Lucians.
So already we are implementing universal health coverage, although it's in a phased way. And we are admitting as a government that we cannot, at this stage, just put all the services in a basket and tell the people of St. Lucia, all your health care is free. We have to do it in a responsible, phased way so that at every stage we are looking at the challenges, the pitfalls, how can we improve the service so that we have a sustainable health financing model.
Minister Baptiste's emphasis on gradual improvements and the phased introduction of services highlights a strategic and thoughtful approach to healthcare reform. With this model, the government aims to ensure that the healthcare system is not only sustainable, but accessible for all St. Lucians. For Choice News Now, I am Darrell Lionel.